So then talking about fitting the mask to your face, if you have an amazing mask, like the filter is wonderful, but air is leaking in all around the side of it, either at rest or when you're moving your head, then that mask is going to be much less effective because air that's unfiltered is getting in and you're breathing it in. So there are formal fit testing procedures that they do like in hospitals and healthcare settings where they actually have you put your mask on and they put you in this kind of like a hood and they nebulize some kind of really nasty, bitter tasting solution in there. And they have you move your head up and down, left and right, side to side, and see if you can taste that nasty, bitter stuff in your mouth through the mask. And if you can, it means it's not fitted well to your face. And so what they do then is they have you go back and either get a different size mask or they adjust the fit, like the nose bridge and where the straps are on your head and everything, and retest it until you find one that's got a really good fit for you. Because that's the only point where the mask is safe to wear into a room where there's aerosol infection. The US Army actually has a guide that is available for mask fitting in the field, meaning if during like a high demand scenario like a pandemic, if you can't get a certified mask or you can't get one that was pre-fit, how can you actually do the testing yourself? And they've got a good guide for that. And there's a YouTuber called Newstrom who actually walked through his own process of following that guide and doing fit testing on his own mask. The stuff he bought, it cost about $60. The video is long, but it is time-stamped. And so we'll be sharing this link in Mighty Networks after, and it can walk you through. And we'll have some links as well to just a formal fit testing kit that you can buy that's got all the same kind of equipment that you would use in a healthcare setting to formally fit test a mask too. It's just that's a more expensive option. You're looking at probably close to $300 for that kit, but it can be used for many, many, many mask fit tests. The other thing that's a possibility is if your mask is not really sealing that well to your face, particularly if you're using more of like a surgical mask or a cloth mask, there are these external straps that can, or mask braces that can fit over the mask and they can kind of seal it to your face better so that you get a better fit. There's one called Fix the Mask, picture to the right. There are several others as well. So the mask fit is really critical in making sure that the mask is working properly for you. So next I'm going to go into eye protection. We're going to talk a little bit about study data pretty briefly, and then just some different examples of eye protection you can use. So there are several studies, including this one, that have shown that people who wear glasses actually had lower COVID-19 infection rates. And so this has been seen in a couple different studies. The one to the right is just one example. And so essentially eye protection, it's not a replacement for wearing a mask. Definitely the mask is number one. Eye protection can be added additionally in areas where, let's say there's really high community transmission, you're in a very high risk area, it's crowded indoors, poorly ventilated, or let's say you're in an area where there's a lot of people who may be infected, like you're waiting in a doctor's office lobby that's crowded, or you're going to like the emergency room, or you're going to a waiting room in a hospital setting. Some examples are just glasses, just regular old glasses. The studies have shown that those do actually reduce the risk somewhat. There are glasses that have splash guards. So they're designed to protect your eyes from like things that may splash, but they've got basically they seal the gaps on the sides of the glasses, the top and the bottom. And it's not a perfect seal. It's not going to keep out airflow or anything like that, but it will help protect against some droplets that may try to come in from the side. There's also face shields. Face shields, cheap and available. Obviously, you're still getting airflow, and this would not be something that replaces a mask by any means. It would just be something that you might wear over a mask that you have on. Generally speaking, you want to get one that doesn't have a gap between the visor and your forehead, one that kind of wraps further around your ears, and one that goes below the chin, unless you've got a really, really good mask. And then let's say you're going into somewhere where you're, let's say on a very, very crowded subway train, and there's people coughing around you and things like that. So that's like a really high exposure area. You might want something that seals around your eyes. So something that would keep out air from getting into your eyes. And this is something where you can use something like swim goggles or certain types of safety goggles that are designed for keeping out caustic liquids to the eyes. So one example, I actually bought these myself during the pandemic, is the Roca X1. These are swim goggles. They cost about $27. They have a larger area of view. So a lot of swim goggles have a very tiny spot that you can see out of. These have a much larger one, which is why they were kind of going around in some of the pandemic circles for a while. There are also other safety goggles and other swim goggles that can be used too.